Your parents always told you to drink a lot of milk because the calcium was good for you, right? Well, if you drink the milk, that's true. But if calcium gets in the arteries, it's bad. Dr. Henry Sadlo is an assistant professor of medicine at U of L and the head of the cardiovascular disease prevention at U of L Physicians. He's here to talk about a calcium scanning program that might predict if you're going to have a heart attack and other issues surrounding your cardiovascular health. Henry, it's good to see you again.
Thank you, Mark.
How are you, sir?
Letting me be here. So what you started off with, I drank a lot
calcium?
of milk. And one thing people need to know, the calcium that builds up in plaque and arteries has nothing to do with dietary calcium. So make sure people
drink the milk. Milk's okay.
Keep drinking the milk, but what you want to do is avoid the inflammation in the arteries that leads to the inflammatory process. That's what puts calcium in the arteries. It's a byproduct of inflammation in the heart arteries, brain arteries, any artery in the body.
Well, I don't think anybody I didn't have a clue that calcium even was in your blood, potentially in your arteries and in your bloodstream. I've heard of calcium deposits like on bone spurs kind of stuff, but I never heard of it in your arteries.
Well, the fortunate thing about it is what it provides for us clinically is a marker where we can find plaque in arteries with a simple CAT scan before it ever causes a heart attack or needs bypass surgery and things like that. So it provides a very valuable tool. The more calcium that's built up, the higher your risk is. A group, primarily some people at Johns Hopkins, 15 years ago, started a large study called the MESA, multi-ethnic study of atherosclerosis, and which is plaque. That's the fancy doctor term for plaque, atherosclerosis. Okay. But so coronary artery disease, coronary artery plaque, coronary artery calcium, atherosclerosis, hardening of the arteries, they're all the same thing.
All the same stuff. Okay. So when we hear those terms, they're interchangeable.
Interchangeable.
And you talked about this scan that you can do. Why don't you tell us a little bit about the scan you can do for the calcium?
So this is a CAT scan, just like anybody would get a CAT scan of your brain, your ankle, CAT scan. But the advantage is there is no dye injection needed because calcium is radiopaque, meaning it will show up on an X-ray or especially on a high sensitivity CAT scan. So, and the other good thing is the type of scan that we've set up at the University of Louisville, other hospital systems in the city have it too, but it's very low dose radiation. It's about the same amount of radiation that a woman would get with a mammogram. So here we have a tool where we can pick up heart disease earlier, and it's not expensive. We probably lose money at the University of Louisville Radiology Department. It's $99 for a whole CAT scan. That includes everything, interpretation. Mm-hmm. So it's a tool where people that are at high risk can find out earlier than just waiting for a heart attack or angina to happen.
And what does it show? What's a bad CAT scan going to show me? Just that there's a blockage in an artery?
Yes, what it'll tell us, it will pick up, first of all, the only score that you can get that's normal is 0. Even a low score like 3 or 4 or 5 means you have some early calcium buildup. So the score is counted by the CAT scan computer, and my record score was 6,600, which is astronomical. The arteries almost look like bones.
Well, that guy's going to die tomorrow?
Well, fortunately, we were able to put 2 stents in him, and he's still doing well, and his shortness of breath went away that he thought was just getting older. But that's one of our success stories, one of many. But we've had people with lower scores of 150, say, that had a 99% blockage because they didn't have a whole lot of calcium, but they had additional soft plaque. So we don't see the softer plaque. So it's a marker. It's a very helpful tool. Mm-hmm. We can put people in the low, medium, or high-risk groups. And then the medium and high-risk groups, we do further testing. Or we put them on a cholesterol medicine, and we tell them to do all the smart things that you and I know to do.
Yeah, of course we know what to do. Whether we do it or not, that's a whole other story. We're talking with Dr. Henry Sadlo, who's an assistant professor of medicine at U of L and also the head of cardiovascular disease prevention at U of L Physicians. When you get one of those CAT scans and it shows a significant amount of blockage of calcium in it, can you say, Mark Hebert, you got a really severe blockage. If we don't do something about that, you're going to have a heart attack within 2 months, or you're going to have a heart attack within a year. Can you predict that?
So not with the scan itself, because I have 3 or 4 patients that have very high scores over 2,000, so they've got a lot of calcified hard plaque in their arteries. Most of that's genetic. Most of these people have never smoked. They exercise. They look ideal body weight like Mark does here. Mark keeps fit. But anyway, but these people genetically have plaque buildup, but they've taken care of it. So their plaque is hardened and may not cause angina, may not rupture and cause a heart attack. So it's a good part to start, but it doesn't give you that answer. You need to get a further test, nuclear stress test, stress echo, and in some cases we go straight to heart catheterization, which is a dye test, putting dye in the arteries, if someone gets one of these scans and has very high-risk features. That's uncommon, but it does happen.
All right, Henry, let's talk a little bit in broader terms. What is the cardiovascular disease prevention unit at ULP? What do you do?
Well, Dr. Andrew DeFilippis is one of our...
I know Andrew. He's been on the show a few times.
And so he headed it up even before I came to University of Louisville. And so he sees patients. Dr. Shahab Gafgazi is one of the three of us that we focus a little bit more on this. Dr. DeFilippis does some research, works a lot at U of L Hospital. So probably of the three of us, I'm more of the person that sits in the office, and a guy will come see me as a new patient and say, my brother just unfortunately dropped dead of a heart attack at 45. What can I do? Mm-hmm. And then I take over.
Okay, and that is out at St. Matthews, isn't
well,
it? It's not, or is it
our
downtown?
Our new University of Louisville office is at the Springs. We just opened that up. It's very nice. We can do tests in there in the spot. Since we're not a hospital facility, some of our charges are more economical for people as opposed to if you get a test done at the hospital. They're allowed to, they have higher costs. But so we do that. And then, of course, Dr. DeFilippis and Dr. Gafgazi are down at the University of Louisville. They also have some nurse practitioners working with some dietitians. They don't try to focus on just one aspect. They try to take care of the whole patient.
So if a person wants to find you guys and thinks, well, I got a history in my family or something's going on, and I just want to get some tests to see if I'm at risk, they can come out to the Springs out in the East End, out in Dutchman's Lane, and get a test.
And then even better, this test can be ordered by any physician, nurse practitioner, or PA in the city of Louisville that has a Kentucky medical license or an Indiana medical license. So basically, let's say one of the internal medicine doctors, Dr. Kathleen Morris out of Jewish Northeast, or 1MD, Dr. John Varga, wants to get one. Most hospital systems have this program. I'd like to brag on our radiologist, Dr. Garth Beach, who's a Hopkins Harvard trained guy, and he gives the most detailed report of anyone in town. So we've done between 700 and 800 of them now. But anyway, the primary care doctor, we have a brochure on the ULP website. All they need to do is fax an order to the University of Louisville Department of Radiology. So they do not have to see one of us. We'd obviously be happy to do that, especially if they don't have a doctor. That's a problem. But any doctor can order this test.
All right, let's talk about heart disease prevention in general. What are some of the things that are the markers or that can predict that I may be at risk of heart disease? Is it always my family history, or is it something else?
Well,
or is that just one thing?
The family history is the absolute largest. So what I do for people, I take my hand and the digits of the hand, and the smoking is one, diabetes is another, hypertension is another, hypercholesterolemia, high lipids, and then the biggest is the family history. So all five of those, we look at that. The more of those you have, the more at risk you are. There is something that people can go on their phone and look up at the ACC risk calculator. It's a tool that people can use. They have to put in their cholesterol numbers, their blood pressure, but it's pretty simple. But the problem is they don't have a family history factor in there. So that tool is somewhat helpful, but it doesn't answer all the questions.
If my father or mother, my direct descendants, have had a history of heart trouble, either one of them, am I likely to have heart trouble?
Yes, surely if both of them do. Now, if your father was a 3-pack-a-day smoker,
it might have been something else, right?
But that's the problem. Let's say that he has bypass surgery at age 60. Well, we don't know how much is genetics, how much is lifestyle and smoking and eating improperly, lack of exercise. All those are risk factors. Mm-hmm. So it's hard to know. Well, we now have a $99 scan that says, hey, unfortunately, you've never smoked and you've been healthy, but unfortunately, your score is 300, which is in the moderate plaque category. and you're at risk, even though you've done all the right things.
Right. We're talking with Dr. Henry Sadlo, who's the head of cardiovascular disease prevention at U of L Physicians, and he's also an assistant professor of medicine at the University of Louisville. And when you talk to patients that have a family history like this, they come in perhaps for the test. What do you tell them? Do you tell them? Do you ask them right then? Hey, do you smoke? Do you drink? Do you do? I don't know what are all the other things you mentioned. You start with that, but then what do you tell them?
Well, what you just hinted on is critical. It's important for whether it be a nurse practitioner in a family practice office or myself. It's very important to get a detailed history of the risk factors, and even more importantly, or equally importantly, the symptoms. Do they have tightness in their chest? Do they have chest pressure? Uncomfortable feeling when they exercise? Are they short of breath without a good explanation? Do they have unexplained fatigue? All that is part of what I take into consideration. Now, if I've got someone that's just anxious, they want to know if they have heart disease, their mother and dad are both living in their 80s and they don't have any risk factors, I say, you do not want to even get a small dose of radiation because you don't need this test. So it's important for people that don't need it not to get a small amount of radiation.
Well, let me ask you, as a guy that used to do surgery, right?
Well, I used to do heart catheterizations and
yeah.
find the blockages. But my friends, Dr. Sam Pollock, Dr. Steve Etosh, and now Dr. Brian Gansel and his group, they do the surgery. They've done a great job.
They do the big surgeries,
They've
right?
done a great job over the years.
Well, I want to ask you about cholesterol because 10, 15 years ago, everybody was on cholesterol drugs. If you had an overall cholesterol count of 200 or better, chances are they were putting you on some sort of cholesterol-fighting drug. Nowadays, you're hearing more and more that there are side effects and other things, and it seems like doctors are backing off. That is that the case? That they're or what? I mean,
yes
what do
and
you guys
no.
recommend?
The experts tell us more people need statin medications and other medications than are on it right now. But there's clearly a group that may be on it that don't need it. So if someone is having some muscle aches or minor side effects from a statin, that's the most common, and yet they get a coronary calcium score of 0 and they get a carotid ultrasound screening, and if they have no plaque, then those people will take off, tell them to work harder and diet and exercise. So not one size fits all, but it's important. But there are clearly side effects.
So all the commercials we're seeing on television don't necessarily believe all the claims that you may not be somebody that necessarily needs it.
Yeah, and unfortunately, a lot of the it's attractive in the New York Times if they say statins are bad, they cause memory loss in the elderly patient. Well, that might be 1 or 2%, and those people will take off of it. But the problem, that scares the other 50 to 60% that need it. So that's unfortunate. I have to work against that. I have to correct that.
I got you. Is there anything else out there, any new research or anything out there that is doing a better job of potentially predicting heart attacks in folks?
Yes, we're not there yet. In fact, I just read an article this week in the Journal of American College of Cardiology, which is our Bible journal, but they're doing a little more detailed test called a CT coronary angiogram, where they do inject dye. It's a much higher dose of radiation. They're working on this test, CT angio of the coronary arteries, because what they're looking for, they can also see the soft plaque in addition to the calcified plaque. The softer plaque with a thin cap is the one that's at risk for heart attack. They're trying to find a way to define that without a lot of radiation, without a lot of expense. And then if we can say that these plaques are likely to cause heart attacks, does it help us if we put a stent in there, even though the blockage is only 40%, which normally we wouldn't, but if it's a high-risk plaque. So that research is going on right now.
That's good stuff. All right. And if folks want to find you, where do they find you, Dr. Henry Sadlo?
Okay. Well, I have something that I'll give Mark with our address at the Springs.
You got a quick phone number? Or
yes,
it's at the Springs out in the East End, out in St. Matthews.
The exact number is 6420 Dutchman's Parkway. We just moved into it about 6 months ago, Suite 375. Or the phone number is 502-588-7010. And then University of Louisville has a website where you can pick up either myself or Dr. DeFilippis, Dr. Kafkazi, depending on if you want an office visit downtown. Right. And once again, I have a lot of good friends working with Norton's Baptist, Jewish Hospital, Hardin Memorial, plenty of other great cardiologists and primary cares in town. So just make sure you see someone, especially if you're having symptoms.
Okay, very good. Dr. Henry Sadlo, always good to see you.